We are live. Woo, woo. I'm looking forward to this conversation, Larry. I'm
Me
excited
too,
about
me
this.
as well.
Yeah,
Yeah.
yeah, yeah. Well, thanks everyone for attending and welcome to our LinkedIn Live session. So this session is going to focus on these cybersecurity pitfalls that have crushed clinics like yours. So those who don't know me, I am Chris Grasso. I'm the founder of FASTx Partners, where we really work to focus on bringing strategic and fractional leadership to mission-driven organizations and really focusing in on the healthcare space. I'm very thrilled to be having this conversation today because it is a critical conversation. And what we really want to focus on is how we can help you prevent some of these pitfalls that other organizations have run into as of lately. And so a lot of vulnerabilities, but things that you can do right out of the gate. Very excited to be having this conversation with Larry today. Larry is our associate at FASTx Partners, our fractional chief information security officer. He has lots and lots of experience in this area. He's also the founder of Inherent Security. Larry, maybe for those who don't know you, could you just do a quick introduction?
Appreciate it, Chris. It's a pleasure being here. So I'm the founder of Inherent Security, and we work with healthcare providers and also health tech companies more so. And essentially, we provide HIPAA compliance services and also CISO services. And I'm ready for the conversation just to dig in. Hot topic, cybersecurity and healthcare. Healthcare remains the number one industry in terms of breaches year over year. I'm hoping people will find a lot of value in the information we can provide today.
Yeah, yeah, I'm looking forward to it. And one of the areas that's like really dear to my heart is mission-driven organizations. I've worked at a FQHC, Federally Qualified Health Center, for more than 20 years, but worked at a lot of other nonprofit mission-driven organizations. And nonprofits, they really are dealing with some of the most vulnerable populations, caring for people with chronic conditions and diabetes, taking care of people's behavioral health and doing all that preventative screening work. But a lot of times people don't think about how cybersecurity really ties to mission. So I'm wondering if you can really talk about that importance and kind of unpack that a little bit for folks.
That's a great
Yeah.
question. And I would say 90% of the time overlooked, right? Tying the cybersecurity with the mission. That's really how you get the trickle down effect and you start breaking the silos. You get the senior leadership support and actually building the culture of cybersecurity. The comparison I like to make, which I feel like is the easiest, is Netflix, right? Their mission is to entertain the world. So what systems, people, and processes are they using to entertain the world? And that's where cybersecurity comes in, and the protecting those systems that help them entertain the world is how you incorporate security within that mission by protecting the systems, having secure processes, and also identifying those people who are very important to supporting those systems. But the key understanding to this is really to understanding how you tie cybersecurity to that mission, because if those systems, people, and processes aren't able to operate because of a breach or whatever might happen, then Netflix is not able to entertain the world. So that's how you tie it to the company's mission. And it's very important to really build that foundation and that culture of cybersecurity. And I feel like that's not explained to senior leadership as well. Everybody always says, how does that correlate with the mission of what we're doing? But once you explain it into those terms, now they say, okay,
Yeah, I mean, this of itself, we could spend at least a half an hour talking
right.
about this. But really, what it comes down to, if an organization has a cybersecurity breach, that's shutting them down. So that means no mission means patients can't get the medications they need. They can't get their lab tests done, right? This means that the critical care that we do in day out for the people that we care about the most, we just we can't serve them. We can't help them and support them.
Exactly.
Yeah. And you touched on something that I want to talk about a little bit. So, we've been working in technology for years. I think sometimes this is still kind of pervasive throughout the community that like cybersecurity is an IT problem. Like just let your
Oh,
IT
yeah.
team kind of go deal with that and fix that. But can you talk about why it's not an IT problem anymore? It's like leadership issues, right? It's a leadership problem. It's an organizational problem. Can you touch on that a little bit?
Right, and that is the biggest killer of cybersecurity. So it goes back to that fundamental concept of tying cybersecurity to the mission and having that trickle down effect. Once it's just IT's problem, you're solely focusing on one specific team. What about development? What about marketing? What about the other core departments that help the entity achieve its missions? In this case, patients. Everybody has a role to play in terms of cybersecurity.
Mhm.
It's really a culture shift, and that's why it has to start from the top and trickle down.
I think one of those areas is that it's such, people hear cybersecurity and sometimes it's like, I feel like people just want to, when you jump in the water, hold your nose and you hope everything's going to be fine. I think that's sometimes how people approach the issue. And sometimes it's such a huge topic that they don't even know what it means, right? And so there are different types of assessments that organizations can do to really evaluate their posture. They can evaluate their weaknesses. I'm wondering if you can talk about the differences between risk assessment and a gap assessment, just so that people can wrap their heads around that and what they might need to do for their organizations.
One thing I left out about the previous question of it just being an IT problem, for cybersecurity to work, you have to think of your administrative controls. Those are your policies and procedures. Now, what one of the misconceptions about the administrative controls is we have policies in place that could be templated, even worse, but that's where the buck stops, right?
Yes.
And
Yeah.
the thing about cybersecurity is if it's not enforced in some way, shape, or form, then they're just words on paper. You have to have the policies that are enforced. And something else that's very big, and it's a requirement of HIPAA, are sanctions policies. I write about this all the time, and people don't like when I mention sanctions policies, but we're really at a place now in healthcare where you have to have sanctions policies. Now, that means if somebody fails security awareness training, that you fire them, strike one, but that might mean they need additional training, step two, if they fail again, then you might need to get a manager involved with this. So there's steps that you take in terms of sanctions, but you can't not do anything about it. And fast forward, you have your technical controls, which are going to be implemented by your technical teams, and any physical security controls in terms of entering your business, how people are managing their devices, which is also overlooked as well. So you have to have the administrative, technical, and physical all tied in together to really have a thorough. Now, fast forward to your question. When it comes to risk assessments and gap assessments, the words get used interchangeably. It's in healthcare, they're two completely different things. And I would say for the past decade, risk assessments are the number one finding when it comes to an OCR audit. When I've done HIPAA assessments, they're always the number one findings, right? And that's when you're going to identify the threats and vulnerabilities to that organizations, what current security controls you have in place, and the likelihood, the impact based on that vulnerability that you find, and come up with severity ratings which help you prioritize which you need to remediate first. That's the risk assessment. Now, what's completely different is a HIPAA assessment. It's varied a little bit, but if you look closely to the current HIPAA security rule, it's where you have to evaluate the effectiveness of your security controls. And that's what a HIPAA assessment is when we want to go through the list of all the HIPAA security requirements, and we want to find the deltas in what that organization is currently doing and what they might be lacking. We come up with some recommendations on how they can close those gaps. And also, not to mention, if they are meeting, some of the security requirements, we just don't want to check the box and say everything's good. We also want to look and say, okay, now what have they done between the last, 1-2 years or whatever the time frame is to mature? Have they matured in those controls? And if not, then we want to provide recommendations.
Great. Yeah, you provided so many nuggets in there. I'm going to try to unpack a bunch of
Sure.
those, kind of dive into a bunch of those. So you talked about having policies in place, and some organizations don't have policies, so that's a first step, right? It's about, and I'm going to have you answer where they could think about going to get some frameworks to dive into that and guidelines. But there's another piece of this is that sometimes organizations have policies, but a
Right.
policy isn't enough, right? You can
Not
have a
at all.
policy about, this is our disaster recovery, but if you never test that,
Words on
right?
paper.
Words on paper. Exactly.
Exactly. And I've seen it more often than one would like to. But to be fair, the reason why clients seek me out is because of resource constraints, right? So they know these things need to be done, but they don't have the bandwidth to do it, or they've given that task to the IT ops teams or the dev team to take on security, and they're already burdened with, maintaining IT operations or, doing development work, that sort of thing. Too often, disaster recovery and also, incident response. We can kind of go down the list here of things that you should be testing on a consistent basis, backups. But you're right. If just having words on paper really mean nothing, it's really not going to keep you secure. I can quite confidently say that these breaches that we see in the news on a consistent basis, I'm sure these entities have policies in place.
Yeah. And like you said, it's one thing to write it down, but you don't really know if you haven't missed a step somewhere unless you actually go through each process to sort of see oh, we forgot about this. Oh, we need to document this. Oh, this isn't a part of our workflow. We forgot about this server over here, whatever it is, right? So
Right.
that's actually walking through that process, and step by step, you can sort of identify where some of those vulnerabilities are. And if you need to, cut off access pretty quickly, you need to know where those levers are to do that.
Right. Absolutely.
Yeah.
Absolutely.
Yeah.
Yeah.
Yeah. One of those areas that you talked about, there's an old adage in healthcare that you've probably heard of this before. An ounce of prevention is worth a pound of cure. And
Hmm.
so I kind of keep thinking about that with cybersecurity. And I think about that with risk assessments. A lot of times we think, oh, we don't have money in the budget to do this. But I mean, you can probably talk about this for a long time. If you have any sort of a cybersecurity attack or breach, I mean, we're talking hundreds of thousands of dollars into the millions, literally, right? I mean,
Right.
and you're lucky if that happens. But that's even if your
Right.
insurance covers it, you're going to have a loss of patients. I mean, it just goes on, right?
Right.
On and on the risk. So, but the reality is while that may be cost $100,000 or millions of dollars, literally doing an assessment every year is what, 1%, maybe 2% of that cost of a breach. So when we think about it, it's worth the investment. And the thing that I often talk to people about is like, start thinking about cybersecurity as part of your operations, right? Just like we budget for keeping the lights on, electricity and water. We should really be thinking about cybersecurity as a line item, right? In our budgets, right? So I don't know what your thoughts around that in planning for people when they're planning their budgets every year for fiscal year. So if you want to kind of talk about that a little bit.
I think you're spot on. You said everything that needs to be said. It definitely needs to be a part of your budget. It's almost alarming that in 2025 we're still struggling with that, making cybersecurity a part of the budget. It's tenth of a fraction, like you said, the cost just to do an assessment. Um, Rather than if a breach actually happened. That trust is not there, the money is no longer there. The list goes on because you didn't want to include cybersecurity in your budget. I've been hearing a lot lately is AI is going to help
Mm,
out security in healthcare. Right? AI can help out security if there's an existing team, but if there's
right.
no existing resources there, if you're just giving tools to an already overburdened team, then it's not going to help and you're just wasting money. It's best to supplement that with an MSSP or a fractional CISO to help support your organization and get the same quality at a fraction of the cost versus using that money to purchase the AI tool, because it's not the tool. The AI tool, it will make things more efficient and it can help in enhancing detection, and it can help augment a team that already exists. But if that
Right.
team doesn't already exist, the tool is not going to help. So, that's the long way of me saying when you're making that cybersecurity budget, make sure you're budgeting for personnel.
Yeah, 100%. This is not your father's cybersecurity anymore. Things are so advanced now and moving fast. And as you mentioned, a lot of these IT teams, they're like a jack of all trades, and particularly in some of these smaller organizations, and they just kind of can't keep up with it. So
Right.
this is really where if you have a heart condition, you go to a cardiologist, right? You go to somebody who's a
Exactly.
specialist in that field, and that's really where cybersecurity is moving at this point.
Right. You're not going to a foot surgeon. So why do we want to do it with cybersecurity? I would say just like you're not going to have the cybersecurity guys developing your new app, right?
Right, right. Yeah, we have to really start thinking about cybersecurity in that way. It's so sophisticated now with the systems, like you said, AI, the bots, everything. And it's a lot for people to keep up on. And so that's where it's really important to bring in an expert to really help make sure that your organization is secure.
Really quick, one thing I would like to add, Chris, a lot of times, healthcare entities don't know where to start, right? And I think you
Right.
brought up
Yeah.
that point, an assessment. That is the best place to start,
Mhm.
because before you want to develop on a roadmap, any tools you want to
Mhm.
purchase, any of those things, first you need to figure out where you currently are at.
Right.
Once you have that information, you can build a roadmap. So I really would highly advise any, healthcare entity that's lost to start off with an assessment to see where you're currently at so you can build that roadmap. You can share that with your leadership to say, hey, this is what our current state looks like, and this is what it's going to take to get us to X, Y, and Z. You might find out could just be a resource issue. It might not necessarily be a tool, because a lot of times I notice tools already exist. Security features exist in your existing tools that can help
Mhm.
supplement what you're doing, and you might not necessarily need anything advanced. You can discover that through an assessment versus purchasing tools to think that's going to really help the problem.
Yeah. Yeah. It's like you don't know what you don't know, right? You don't know your
Exactly. Yeah.
vulnerabilities until and it's almost like, how people go to the doctor every year to get their physical, their annual exam, right? We go there to get a checkup. We go there to make sure all of our systems, are working correctly. It's the same process, right? We're going through to make sure all of our systems are working correctly.
Right. They're not prescribing X, Y, and Z before they've assessed what the root cause could
That's
actually
right.
be.
Right. Right, exactly. It's going along the same lines. We're not prescribing heart medication if you don't have heart disease, right? We're sort of like, we're evaluating you first to see if there's anything
Exactly.
on there. So going along those lines, one of the biggest areas that I see in gaps in organizations that I work with, and nobody's really perfect in this area, and I think, we all have a long way to go, is asset management, right? I mean, we are so heavily reliant on technology, laptops, phones, other devices. And that's a big vulnerability. But I also think that's a big opportunity to really rein in some of the risk attached to that. Like you have people who are working on site, you have people who are working remotely, and oftentimes, organizations, they get their laptop, a new person starts, they image it, throw some antivirus software on there, say, okay, you can log in with your network password and username, and you're all set to go. But it's beyond that. It goes much bigger than that. I really do think that that's an area where people can sort of really tighten up and really reduce their vulnerability. So I'm wondering if you could talk a little bit around asset management.
Right. And the majority of entities are functioning in the dark, what we call shadow IT. And there's such a range when it comes to asset management, right? And you said this a few seconds ago, and I'm going to say it again. You can't protect what you don't know you have,
Hmm.
right? So that's what's so important about asset management from a infrastructure perspective, understanding what and documenting, not just understanding, because everybody understands. They don't document
Right.
documenting what cloud host providers are you using, right? Because you're going to want to fast forward to say, okay, do we have BAAs for all these cloud hosting providers? Same thing with third parties. What third parties are we using? It really helps you build the picture around where you stand in terms of security holistically as well. And it also helps you identify threats faster because if you have Windows machines, you have Mac machines, and you're subscribing to vendor feeds to say, hey, we found a zero day in our software, you can correlate that to, your spreadsheet or whatever you might have to say, do we have any systems that's running this software? And by the way, we're supposed to be scanning our assets for vulnerabilities anyway, right? So a lot of
Right.
these tools are your asset management tools. If you can kind of correlate and prevent a lot faster if you're maintaining your assets.
Yeah. And I know we want to use technology. It's this shiny new tool that's going to solve all our problems, but little do you know that's actually opening up the gateway or the portal to much bigger issues. And for a lot of organizations, we rely on third-party vendors, right? Whether that's an
Right.
IT managed service, we talk about AI, but we could be sending data out, as part of a compliance, project that we're involved with, software vendors, the list kind of goes on and on. So and I often think that that's one of the silent killers, right? That's one of those areas where it's a big silent threat. So I'm wondering if you could talk a little bit more. You kind of touched on this, but if you could give organization one more tidbit that they could take away today and how they should be dealing with vendors that they're working with. What's one thing that they could do today, like right out of the gate, to sort of assess some silent threats there or vulnerabilities?
When it comes to vendors, what we're seeing a lot now is essentially, do you have a SOC 2 report? Okay, you have a SOC 2 report. You're secure in our eyes, and that is really hurting the industry, and that's why we're seeing third party breaches on the rise. Healthcare was number one in terms of third party breaches, 42% across all industries. There needs to be more due diligence in terms of our vendors. And I really think that comes from digging a little bit deeper. Okay, we've seen your SOC 2 report. Now let's go through these list of questions and see where you are in terms of cybersecurity. And does it meet our risk tolerance
Right.
based on, these questions that you're asking? We really feel like we want to move so fast that we don't want to spend more time to do due diligence. But again, if third parties are in the top three primary concerns of breaches, we're going to need to do more due diligence. And if we have existing third parties, to be quite honest, you have to switch. If they're not meeting the compliance requirements, I mean, if they don't have a BAA from the jump, you're in violation there.
Right.
You need to switch, right? You don't know we're dealing with protected health information. And if they do have that, but they're just laxing in terms of cybersecurity, I think you give them XYZ period to get up to speed. And if you feel like they really can't meet those requirements, then it's cheaper to switch.
Yeah.
It's cheaper to
Yeah.
switch. Yeah.
Yeah, and I agree with you. And I think what happens sometimes too is like we get involved with, third party vendors that we have very long standing relationships with, maybe 10, 15 years. And sometimes, people just weren't thinking about BAAs right at that point, or
Right.
it's like staff turnover and something gets missed along the way. But it's not too late to sort of stop and reevaluate that. And I know we're all busy, but again, this is really critical to the operation. So what's important for organizations to have is their own internal standards and checklists that they expect every organization that they're doing business with whether that's somebody new or an existing organization, that they should have a basic level of standards that they require for their organization.
And this doesn't, the buck doesn't stop at software vendors, because we think in terms of code. This is also for your service providers too, your consultants, right? A situation I came across recently where on behalf of the client, we sent out some security questionnaires, and one of the service providers said, "Can I help him out fill this out?" Right? Which is a flag in itself, right? That's not that
Yeah,
good. And also in the same, instance, some of the service providers filled it out as if they didn't really care. They were just
yeah,
copy paste the same answers, going down for everything. And that's another flag. That really shows you how much those providers actually care about your business if they don't really want to take the time to flat out. And, as a founder, that makes me think, I don't know if I can trust this person with my data because they don't care too much of filling this out. Do I want that person working for my business? Because if something happens to my business on behalf of that person, regardless if they have insurance, I'm going to have to deal with all the pain.
You're 100% right. And I also have a real life example of that where I was working with an organization and, they were providing scribe support. So
Hmm?
we asked them to, there's, some changeover in staff. So we said, we want you to fill out this, risk assessment. And they returned it with like almost a lot of like NA, 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 NA. We're like, what do you mean NA? This is,
Exactly.
of course it's applicable. And then they went on to say, well, none of our other customers ever really asked us to do this. And we're like,
What does
what?
that have to do with me?
Right, exactly. Exactly. And like now's the time for you to figure that out. So we're like, we can't do business with somebody who's providing us with a risk assessment that says NA all the way down. This doesn't work for us, right?
Exactly.
So I'm curious from your perspective, you work with a lot of healthcare organizations. What are some of the most common threats that you're seeing today?
I'm glad you asked this question because that goes back to really everything we're talking about asset management and working with vendors. What's very important for healthcare entities is to understand the threat landscape, right? Understand that third parties are within the top three in terms of threat in healthcare. Because once you understand things like that, that's where you really need to focus your attention to those different aspects and how they could affect your business, right? I would also mention, of course, ransomware security awareness training is very important. AI, I'm not going to say it because hackers are using it. I'm going to say because you're introducing new technology, and in most environments you haven't managed cybersecurity from your existing technology. Now you're just widening the gap even more with something that could be even more dangerous. AI, that is a threat to your ecosystem as well.
Yeah, what I do want to say about AI, when I talk with a lot of organizations, they're like, well, we're not using AI in our organization yet. I'm like, you are. You just don't know who's using it, right?
Exactly.
Without a doubt, you have people in your organization who are using it, and I get it. It makes life easier for people. So let's figure out how to support people to use it in a responsible way, right? So it is really about doing governance, and this is not to put restrictions on people, but it's about guardrails, right? It's about safety. It's about making sure we're not putting PHI into Chat GPT, right? I mean, there are ways
Right.
to use it and use it in a way that's really effective for organizations, but this is about education. It's new, it's on the scene, but it's really about training teams around how to use this responsibly. That's what it really comes down to. So
And when I think about that, you're saying people taking information and putting it into ChatGPT. I think we might see the rise of the proxy again when we are blocking outbound access to certain sites like ChatGPT. So you don't want to take the risk of having someone plug information in the system. For all purposes, just block it off completely,
yeah.
or
Yeah.
something along those lines.
Yeah, absolutely. It's just again, we want AI to help people. It's a great tool that can really augment staff in the roles, but again, it's really about using it in a way that's not going to put the organization at risk. And that's really the bottom line, is that what it comes down to.
Right. And tracking technologies is
Mm,
big. And a lot of times, the way that's found is either somebody on the dev team and says, oh, we've been sharing PHI with third parties, or someone complains to OCR that their information is being shared with third parties.
gosh,
Watch out for.
absolutely. And people don't even know that they're being tracked, right? There's all this kind of hidden underneath, and it's like you don't know unless you actually go in and turn it off, right? Most of these cases, it comes out of the box defaulted on, right?
Right.
With all these tags. And so I agree with you. That's another big risk for folks as well.
Yep.
Yeah, we had a question from someone, and we sort of touched on this, and this is one of those areas that I want to keep kind of pounding on the pavement a little bit around cybersecurity and cost, right? Because there's sort of two aspects of it. There's cybersecurity kind of controls, right? And then there's like assessments, and those are two different things. But it's also what we really want people to get to is I talked about this a little bit earlier, is like this should just be part of your budget, right? Again,
Right.
you budget for health insurance, you budget for your electricity, you budget for your water, you budget for your rent, budget for cybersecurity, right? Let's just make this a standard part of every budget line item. So I don't know, it's really hard to sort of say what it costs exactly, but I wonder if you would sort of just talk about that a little bit.
It's really hard to identify what that cost is going to be. I think that's where the assessment really helps out, right? You go back to find out where the gaps are, and you're essentially going to have to research vendors to see if what solutions they can provide to help fill those gaps. That's where you really get your numbers from, and then you build your roadmap out and present it to your senior leadership.
All you venture capitalists out there, like, just assume your money is going to be going to cybersecurity. Have that in the back of your mind, as well as personnel too. A couple of things I just want to recap and would love to have you jump in afterwards. So the things that I really took away from this is about, your laptops, your phones, your other devices. Those are assets, but they're also liabilities if we don't know where they are. OCR audits, they aren't just theoretical, right? They're detailed and they're real. So we want to be prepared for that. A breach plan is only useful if you actually know how to use it and execute on it.
Right.
And the other one is, cybersecurity is part of your mission. It's not a distraction from it. Also, being small doesn't mean you're invisible.
I've read that small businesses are being targeted as well. Now, I don't think it's a whole lot within healthcare, but they are being targeted. And again, this kind of goes back to the last thing I said about the VCs. A lot of those companies are startups. It needs to be budgeted in from inception of whatever you're building. We are in that time, where cybersecurity is just a part of doing business.
Exactly. So the bottom line here is a little prevention can save you from a massive crisis. Is the takeaway message here. So if you enjoyed today's conversation, sparked some concerns, questions for you, feel free to reach out to us at FastX. We're happy to jump on a call with you, think through what you might need. We want to keep you on track to care for the patients and some of the most valuable people who are part of your organization and your mission. So thanks for joining us, everybody.
Thanks for having me, Chris. Thanks, everybody.
Thanks, sir. Take care. Bye bye.